Hello, I'm Teresa. Welcome to another episode of Teresa's TCM Clinical Reflections. Today, I'd like to discuss one of the questions I hear most often in the clinic. Patients frequently ask me, Teresa, I can't lift my arm. Is it frozen shoulder or have I torn my rotator cuff? Many people become worried because they search online and immediately see terms like frozen shoulder, rotator cuff tears, or arthritis. The more they read, the more confused they become. Although these conditions often cause similar symptoms, they are actually very different problems. Today, I'd like to show you how I think through this question in my clinical practice and why understanding the cause is far more important than simply putting a name on the problem. Before I examine the shoulder, I always begin with the patient's story. I usually ask, how did this begin? Did the shoulder gradually become stiff over several months? Or did the pain start after lifting something heavy, a fall, sport, or repetitive work? Sometimes patients cannot remember any injury at all. They simply notice that reaching for a cupboard, putting on a jacket, or brushing their hair becomes a little harder every week. Other patients remember the exact moment everything changed. That difference immediately changes the way I begin thinking about the diagnosis. Long before I perform any examination, the patient's history is already giving me valuable clinical clues. One sentence sounds very simple. I can't lift my arm. But clinically, I want to understand how they cannot lift it. Has the shoulder become stiff? Or is movement being stopped because it hurts? This is one of the biggest differences between how patients describe symptoms and how clinicians interpret them. Patients tell me what they cannot do. My job is to understand why they cannot do it. The answer to that question often determines everything that follows. Frozen shoulder usually develops slowly. Patients often tell me, every week my shoulder seems a little stiffer. Gradually, reaching forward becomes difficult. Lifting the arm sideways becomes difficult. Putting the hand behind the back becomes almost impossible. Even if I try to move the patient's arm for them, the shoulder still feels stiff because the joint itself has lost mobility. Pain is certainly present, but over time, stiffness becomes the dominant feature. When I see this pattern, frozen shoulder immediately becomes one of the main possibilities I consider. Rotator cuff injuries often behave very differently. The shoulder may still be able to move, but certain movements become extremely painful. Lifting overhead, lowering the arm under control, rotating the shoulder. Some patients can still lift the arm if they tolerate the pain. Others suddenly feel weakness, as though the shoulder simply has no strength. That immediately makes me think about the rotator cuff. So, although two patients may both say, I can't lift my arm, one may have stiffness, while the other is limited mainly by pain or weakness. Those are two very different clinical pictures. Pain alone is rarely enough to make an accurate diagnosis. I carefully observe shoulder movement. I assess muscle strength. I examine functional activities. Then I perform special clinical tests such as the empty can test, Hawkins test, and Neer test. These tests help me understand whether the rotator cuff may be involved. But clinical tests never stand alone. I never rely on a single test. Instead, I combine the patient's history, movement, muscle strength, palpation, and special tests before deciding what is most likely happening. If those findings still don't fully explain the symptoms, ultrasound or MRI may provide another important piece of information. Imaging doesn't replace the examination. It helps confirm what the clinical findings are already suggesting. Traditional Chinese medicine approaches these conditions from another perspective. Although it doesn't use terms such as frozen shoulder or rotator cuff injury, it asks a different question. Why has this shoulder struggled to recover? Frozen shoulder often reflects patterns such as cold dam obstruction and long-standing blockage within the channels. Rotator cuff injuries more commonly involve tendon injury together with blood stasis. Traditional Chinese medicine doesn't replace modern diagnosis. Instead, it helps me understand why two patients with apparently similar scans may still recover differently and require different treatment strategies. One principle always guides my thinking. Treatment should follow the diagnosis, not simply the symptom. If I believe the patient has frozen shoulder, restoring shoulder mobility becomes my priority. If I believe there is a rotator cuff injury, I focus on protecting the tendon while supporting tissue healing. Some patients respond very well to acupuncture together with rehabilitation exercises. Others, particularly those with significant tendon tears or marked weakness, may require orthopedic assessment or even surgery. Treatment is never chosen because every patient with shoulder pain should receive the same acupuncture points. It is chosen because the diagnosis tells me what this shoulder actually needs. Patients often want an answer immediately. Is this frozen shoulder? Is my rotator cuff torn? I understand that. But I don't rush to give the condition a name. Instead, I ask myself another question. Why can't this shoulder move normally? Once I understand that answer, the diagnosis becomes clearer. A clear diagnosis doesn't simply guide treatment. It also helps patients understand what is happening and gives them confidence in the recovery process. Good treatment always begins with good clinical reasoning. Looking back over the years, this lesson has stayed with me. Two patients may both walk into my clinic saying, "I can't lift my arm." Yet one may have frozen shoulder. The other may have a rotator cuff injury. The symptoms sound almost identical, but the reasons behind them are completely different. Modern medicine helps me understand which structures have been injured. Traditional Chinese medicine helps me understand how this person's body can recover. Together, they remind me that successful treatment never begins with choosing a technique. It begins with understanding why the shoulder has stopped working normally. My responsibility is not simply to reduce pain. It is to understand the cause, explain it clearly to my patient, and help them choose the most appropriate path towards recovery. Thank you very much for watching today's reflection. Take care and goodbye.